Coronavirus answers and questions. In the days of pestilence, the importance of distinguishing between truth and falsehood becomes twofold. Factors such as fear, illiteracy, and prejudice lead to the creation and spread of manipulative speech. In addition, if humans apply the results of previous experiences to new situations, error is likely. Therefore, a few explanations are necessary, as shown below, based on the information provided by 1. Will coronavirus end in summer? The coronavirus, COVID-19, is also transmitted to warm and humid areas. For example, temperatures in the Gulf countries are quite high these days, but the virus is spreading there too. According to the evidence so far, COVID-19 can spread to all areas, including warm and humid areas. Regardless of the weather, if there are reports of an outbreak of COVID-19 in your area, you should take precautionary measures. One of the best ways to protect yourself from the coronavirus is to wash your hands briefly. Fortunately for 20 seconds, thorough washing with soap and water eliminates the virus. This way the virus does not remain on your hands. If these clean hands are applied to your eyes, mouth, or nose, the virus will not transmit, as it may have been removed. Avoid applying your hands to eyes, mouth and nose, even to the face without washing the soap so that it is not possible to transfer from touch to hand. We do not think that the virus died this summer on a scientific basis. Perhaps this concept has become commonplace this season in view of the general tendency to reduce tuberculosis. The virus stays inside the human body with the same temperature, both in summer and in winter. In addition, it can survive for at least a few hours on external surfaces such as tables, chairs, door handles, etc. They are often inside buildings, where temperatures are not high. In summer there is a high temperature outside, but there are not many people. Most of the people are inside the buildings and in the normal temperature. In this case the virus can die if it is outside the boundary but not at normal temperature. Therefore, caution is necessary even when there is heat. 2. Coronavirus dies in cold weather or snow? Just as people in hot areas get the impression that the weather can fight the virus, so in colder regions it is believed that more the cold eliminates the virus. Don't think that cold weather can end viruses or other diseases. Regardless of the outdoor temperature or the weather, the average human body temperature ranges from 36.5 C to 37 C. The best way to keep yourself safe is to wash your hands periodically with both soap and water. For this purpose alcohol can also be used to mix handmade materials, such as handmade teasers. 3. Can bathing with hot water protect the coronavirus? You cannot be protected from the coronavirus by bathing with warm water. Your normal body temperature ranges from 36.5 C to 37 C, whether you are in the tub, under the water, or taking a shower. If you take the bath to understand that putting hot water on the body will cause the virus to die, then it can harm itself because too much hot water is harmful to the skin. 4. Coronavirus spreads by mosquito bites? The season for mosquitoes is coming. Dengue spreads with mosquitoes, where will corona not spread from them? This question may come to mind. To date, there has been no instance that the coronavirus has been transmitted from a mosquito. There is no evidence that the coronavirus can transmit mosquitoes. The new coronavirus is a respiratory virus that primarily spreads from tiny droplets that cough or sneeze at the victim, or transmits from tiny droplets of nasal passages to other ones. Do not approach anyone who is coughing or sneezing. It is advisable to keep a distance of 6 feet, at least 3 feet away from each other even under normal circumstances. 5. Is the hand dryer effective against the coronavirus? No. Can't kill handwheel COVID-19 to protect yourself. Wash your hands periodically with both soap and water. It cleanses the virus by hand. Otherwise, alcohol-based handheld ingredients, such as handmade teasers, will be well applied. After washing your hands, dry them with tissue paper, paper towels or a hot air dryer. Dryers are fine for drying hands, but that alone does not remove the virus. 6. Can ultraviolet disinfection lamps kill coronavirus? Ultraviolet lamps should not be used to clean hands and other body parts from viruses and disinfectants because ultraviolet radiation causes skin irritation. 7. How effective are thermal scanners for diagnosing coronavirus victims? Thermal scanners, which can detect temperature distances, are effective for detecting coronary virus fever whose body temperature has risen. However, after the infection, there is no fever unless they are identified. Usually the person becomes ill 2 to 10 days after the infection and develops a fever. So it is possible that someone has not yet had a fever and has become infected. Nevertheless, their use is very helpful as fever is common in coronavirus. 8. Can the coronavirus be killed by spraying alcohol or chlorine on the body? No. Spraying alcohol or chlorine on the body does not kill the viruses that enter the body. Spraying such material can be harmful to clothing and soft skin areas, such as the eyes and mouth. Be aware that both alcohol and chlorine are used to clear external surfaces, such as floors, etc., but they should be aware of the cleaning methods and instructions as they must be followed. 9. Is the pneumonia vaccine protected from the coronavirus? No. The pneumonia vaccine does not protect against the coronavirus. The virus is brand new and different and needs its own vaccine. Researchers are trying to make the vaccine. Although the vaccine is not effective against the coronavirus 2019 nCoV, other respiratory diseases should be vaccinated for health protection. 10. Can coronavirus be protected from repeated cleansing of the nose with saline? No. There is no evidence that repeated cleansing of the nose with saline can protect people from coronavirus infection. However, there is some evidence that regular nasal cleansers are relatively common with common colds. However, frequent cleansing of the nose is not evidence of protection from respiratory diseases. 11. Can garlic prevent new coronavirus infection? Garlic is a healthy diet that has antimicrobial properties. But there was no evidence that eating garlic could prevent the recent outbreak of the coronavirus. You should use a diet that is healthy so that you can have good immune and other diseases, including coronas, but do not expect that the virus will not be attacked. 12. Does the coronavirus affect older people, or can young people be affected? People of all ages can be exposed to the coronavirus. Older people, and those who already have medical problems such as asthma, diabetes, heart disease, are more susceptible to the virus attack. People of all ages take protective measures to protect themselves from the virus, for example taking care of hands and respiratory hygiene. 13. Are antibiotics effective in the prevention and treatment of coronavirus? No, antibiotics do not work against viruses, but they are only effective against bacteria. COVID-19 is a virus, so antibiotics should not be used to protect or treat it. However, if you are hospitalized due to the coronavirus, you can take antibiotics at the doctor's suggestion as it can also be a bacterial infection. 14. Is there a specific drug for the protection or treatment of coronavirus? No specific drug has yet been prescribed to protect or treat the coronavirus. Although those who have been infected with this virus, they should be properly cared for to relieve the symptoms. The critically ill should be well cared for. Investigations are underway on some treatments, and they are undergoing clinical trials.